Good afternoon and welcome to our third in our series of webinars about VITLAccess, Advanced Training and Live Demonstration. My name is Rob Gibson and I'm the Vice President of Marketing and Business Development at VITL, and I will be the moderator for today's session. Our presenters today are Kat Myers and Fran Clark. Both are eHealth specialists at VITL. Kat is a registered nurse, holds a bachelor's degree in kinesiology from Texas Christian University, and a certificate in applied health informatics from Johns Hopkins University. Kat brings her clinical expertise to bear in assisting practices with health IT implementations such as VITLAccess. Fran has many years of experience in healthcare, from being a floor nurse, a practice manager of primary and surgical care, and as a vice president at one of Vermont's critical access hospitals. Fran assists practices with workflow analysis, meaningful use, and implementation of VITLAccess. Today's presentation is designed to build on the previous two webinars in this series. You will find them beneficial in providing an overview of VITLAccess, Vermont's patient consent policy, and information on how to integrate VITLAccess in your organization's workflow. You will find recordings of these webinars at the URL listed on this slide. Now let me hand the presentation off to Fran.
Thanks, Rob. Welcome to webinar number 3, VITLAccess Advanced Training. In today's demonstration, we will provide a live demo in VITLAccess using a use case scenario. This scenario will provide a deeper dive into the features of VITLAccess, which will include encounters, face sheet, problem list, test results, transcribed reports, medication query, medication management, and continuity of care documents. VITL has been commissioned by the state of Vermont to train healthcare organizations and professionals on our state consent policy and how to access a patient's statewide health information on VITLAccess. Patients must give written consent to allow providers to view their health information within the VHI. Once consent is given, all current and future providers involved with the patient's care are allowed to view the patient's health information within the VHI via VITLAccess. Each healthcare organization must verify or obtain a patient's written consent prior to viewing the patient's statewide health information. Placing an indicator in your EHR might be an internal process for your organization. This can serve as an at first glance. However, VITLAccess is the source of truth. Viewing the consent status within VITLAccess will allow the organization to view if consent has been obtained from another organization and is the ideal workflow. VITL provides additional educations to assist organizations in implementing the consent workflow, such as consent brochures. Patients with complex questions regarding VITLAccess consent can be referred to VITL. You can find the contact information on our consent brochure. VITL provides at-the-elbow training to streamline the consent workflow of VITLAccess in your organization. As a reminder, VITLAccess consent differs from a usual consent. A signature indicating of the patient's choice of opting in or opting out is required. The following are examples of how to integrate VITLAccess consent into your organization's workflow. The first scenario represents the patient arriving to their appointment, presenting to registration, and completing the consent form on the same day of service. Once the consent has been signed, the registration staff sets the consent flag within VITLAccess and has immediate access to the patient records. The second scenario indicates the consent has been obtained prior to the patient's visit, either by another organization or sent in a welcome packet. Patient's records may be viewed, allowing care coordination to begin prior to the patient's arrival. The last scenario represents the clinician receiving notification from patient ping. Patient ping is an alert notification system which notifies the provider of real-time hospital admissions and discharges. As long as the patient has opted into VITLAccess, the clinician would be able to view hospital data when they receive a patient ping alert. This would allow for early care coordination for when the patient presents for their follow-up visit. For more information on patient ping, please visit our VITL website. The following VITLaccess use case scenario is provided for demonstration purposes only. All patient data in today's presentation have been fabricated. The information displayed from the reference organizations is fictitious and used for demonstration purposes only. Okay, so let's meet Ginger Snaps. Ginger is a 75-year-old female who lives in Essex. Her primary care physician is at Alderbrook Family Health, and she usually receives care at the University of Vermont Medical Center. She is being seen at Alderbrook for a follow-up regarding a recent injury and hospitalization at Rutland Regional Medical Center. The care coordinator at Alderbrook sees Ginger as coming in the next day as a follow-up of her recent injury. The care coordinator views Ginger Snap's record in VITLaccess. I'm now going to turn it over to Kat Meyer, who will take us through Ginger's record.
Okay, so this is Kat, and I'm going to take on the role of a care coordinator and walk through how VITLaccess can be used as Ginger Snaps transitions from the acute hospital setting back to her primary care office. The process to ensure that no PHI was used in the building of this patient is going to result in some of the details being a little incongruous with the story, so I'm going to ask you not to look too close at the clinical data as it may not always make sense. Our focus today is to show you functions within VITLaccess. So I have noticed that Ginger will be coming into the office tomorrow for a follow-up visit. I do not have access into Rutland Regional Medical Center's electronic health record. Prior to VITLaccess, I would have to rely on Rutland sending me information from her admission, which may have led to phone calls and faxes in order to receive all the data needed for this visit. All right, so I am on the patient search screen, and I'm going to type in her name, which is Ginger Snaps. I like to do first name last. You can do last name first if you'd like. You just have to remember to put a comma between the two if you choose to do it that way. Now the search is going to return two names. I have Ginger Snaps twice here, but different dates of birth. The one that I'm going to be selecting is the Ginger Snaps with the date of birth of 2/26/41. And you can see I've got this plus sign here next to her name. This is actually some good information before you even get into her record. If I click on that plus sign, it opens up and shows me the different organizations that are sending information to the VHI on this particular patient. Now, I am the care coordinator from Alderbrook, and this ABFH, that stands for Alderbrook Family Health. If this was the only organization that was listed for Ginger Snaps, I wouldn't need to go any further because I already have all that information within my own record. But I can see here that she has information from the University of Vermont Medical Center, and she also has information from Rutland Regional. So before I go into a record, I just want to take a minute to point out the box at the top that says additional records may be available. This is for when a patient has opted out of VITLaccess. Their name will actually drop off this patient search screen. So let's say I'm looking up Jane Doe, and I know Jane Doe is being seen at another Vermont hospital, but she's not here on this list. If she is presenting for emergency services, and in order to provide life-saving services to her, I need to access her record, I could do an emergency break glass. If I click here and say emergency override and then patient is presenting for emergency services, then her name would show up on that list. Now the reason why I'm pointing it out here is that some users think that this is a way to reveal extra information on the patients that are listed here, and that's not correct. This is really just for emergency services. Okay, so I'm going to click on our friend Ginger Snaps here and look at her record. Now I've gone right into her record, so I know that she has given consent. In previous webinars we have shown how to set the consent flag, and if you need a review on that, you can see, I believe that was webinar 2 that goes into that in more detail. But if she had not signed consent, there would be a hard stop there, and I would have to obtain her signature before moving on. So we first land on this patient summary screen, and this is going to show us the most recent 3 results in each one of these categories. Now, as a care coordinator, maybe the first thing that I want to look at is the reports section, and here it's down here on the right. I can actually go in and configure this and say, no, show me reports first. I can grab it and move it over here and then save. And that's actually going to save for my user account. So every time I log in, now reports is going to be the first thing that I see. This screen is nice if you see something that pops up on a patient that you want to jump right into the details of that, either that visit or that report. As a care coordinator, though, and she's being seen for a follow-up visit for a specific hospitalization. So I'm going to jump right into her Encounters tab, which is over here on the left. Now, the first thing that shows at the top are all of her diagnoses that have been sent from all the different organizations. So these are the ones that Alderbrook Family Health has on her, Rutland Regional, and UVMMC. They're going to be kind of merged together here on the screen. But again, I'm really interested in this inpatient encounter that she had most recently. So 2/7/17, that's her most recent inpatient encounter. If I want to get a real high-level view of this without getting too much clinical data, I'm going to go click on that face sheet that was right over there on the right. And this drops me into, this is a little bit more of an administrative page, but it gives me a nice high-level, non-clinical view of what happened. This row here is highlighted in blue, so that is what we're looking at. And you can see there would be some demographic information. I'm going to scroll down a little bit more, and I see her visit summary. So looking at this, she was admitted from the emergency department. It has an admission reason of diabetes, and let's see, her admit date was 2/7. Over here's her discharge date, so she was admitted on the 7th and then discharged on the 10th. It's an inpatient encounter, and it was a routine discharge, so she went home. Other things that you might see here are transferred maybe to another, to a tertiary center, or discharged to a SNF, or discharged with VNA services. And then as we scroll down again, we're going to see a little bit more details. These are the doctors that took care of her while she was in the hospital. Her problems, she had a concussion and a wrist fracture due to a fall. And again, some more administrative information like emergency contact and guarantor. I'm going to go back up and back to her patient summary. Now I want to see the clinical information. So she went into the emergency department and was admitted. Let's get some more information. Here we have that this was because of a concussion, wrist fracture, and fall. If I click on anywhere on this row here, now I'm going to see some clinical information on this. Again, just to orient us, we're looking at Rutland Regional Medical Center's information. And this is going to tell us all the information that is going to be presented related to this encounter. So the encounters view packages all the information related to a specific encounter in one place. So here we're going to see lab results, and we can expect to see lab results, and we can expect to see transcribed reports. If there were radiology reports associated with this, this would also be another tab here, but it hides it because there are no radiology reports in this particular encounter. So I'm going to scroll down, and the first thing we come across is a transcription, and this is like the jackpot for care coordinators, because this is going to tell us about her visit. So here we have all of her discharge diagnosis. She had a concussion, right wrist fracture. She also had a left upper extremity laceration due to a fall, and she has a history of AFib and diabetes, osteoporosis, and hypertension. Now here's her brief history. So this is going to tell us why she was at the hospital. Poor Ginger, she fell. She broke her wrist. She has a big laceration. She had some blood pressure issues, and they decided to keep her in the hospital to resolve that before sending her home. They also wanted to observe her for that concussion. Again, I'm going to kind of highlight what I'm most interested in as a care coordinator here, because that's going to be really important for her transition. We have her medications, and we're going to use these later, so I'm going to call these out which medication she's on. She's on Coumadin, she's on metformin, Claritin, metoprolol, and it looks like they gave her some oxycodone for pain. Her follow-up, she is going home with VNA services, and she's seeing her primary care, which is Alderbrook. That's where I'm the care coordinator, so it's been 2 to 3 weeks post-discharge. And she's also going to be seen by orthopedics, and that should be happening in the next couple of weeks. And she should have already had her sutures removed from that left upper extremity lac by VNA. Now, as we continue down this page, we're also going to see some lab results. And again, I'm going to call these out because we'll see these again later. She had a random glucose that was normal. Here's her result here, was 122. She also had a PT-INR. She had a CMP, and it looks like all of those results were within normal limits, because when they are abnormal, such as this glucose here, we see that is highlighted in red. Well, I just highlighted in blue, but it's highlighted in red, and here's her result of 257. So again, I want to emphasize that these are all of the results and transcribed reports that are associated with one visit. So if somebody was in the hospital for a week or so, you might see a lot of lab results. You might see x-ray results and transcribed reports from consults that she's had while she's in the hospital. So this page could actually be quite long. And perhaps we were more interested in, rather than looking at the full encounter, that we really just wanted to see that discharge summary, or we really just wanted to see trends in labs. And in that case, instead of going to the Encounters tab, I'm going to go to the Results tab. This is the same information, it's just presented or packaged, if you will, in a different way. So here, I'm going to point out, it's that transcribed report, it's the discharge summary. I'm going to click on it real quick. It's the same exact thing that we saw under the Encounters tab. It just shows up by itself. So, I'm going to go back. And also here we have that normal glucose. We have the PT-INR, the CMP, and the glucose that was random, that was abnormal. And all abnormal results are going to be highlighted in red. Then again, if I click on this and I scroll down, this is the only one that we see. Okay. Whoop. Now a couple of other things about this. So again, I talk about how it's packaged. If we look at, here's our random glucose. These are all dated on 2/8, except for the transcribed report, which was 2/10. So in this view, we don't necessarily know that these are all related to the same visit. So one of the benefits of going into the Encounters view, if you really want to know everything that happened in one particular encounter. Now, she's diabetic, so let's say I'm interested in whatever glucose has been, and I want to see what, I want to filter out all this information and just look at glucoses. I can go into this search tab here, and I'm going to click on, I'm going to start typing in glucose, and you can see how that's highlighted in yellow. It's going to bring all of those glucose results and separate them. So perhaps she's had maybe 20 different glucose results. Then all of those are going to be separated from all the other lab results and all the other results. Or I could say, you know what, just show me her abnormal results. And in this case, she has a previous electrolyte abnormal result and her glucose. Or I can say, I just want to know the stuff that was generated from Rutland. So you get the idea. Anything that's in one of these columns here, you can separate out by filtering. Now, let's suppose that she had pages and pages of information, because again, this is being, let's say she has been seen at 5 different hospitals and maybe a couple of different specialists, and so there's a potential to have a lot of information here. You can narrow that down and say, you know what, just show me, there are these little radio buttons, and you can say, I just want to see the transcribed reports. And so I can say, just show me transcriptions. And then if there were transcriptions here, there might be transcriptions from consult notes, or maybe there might be 20 different transcribed reports. You can say, all right, show me the discharge, just the discharge summary, and you can start typing, if you spell it right, discharge. And again, so you can kind of filter within the filter there. Up here, also I'm going to point out that it defaults to the last year's worth of information. And let's say you wanted to see something that maybe happened 5 years ago. You could also, then you would want to click on all results, and that would load everything that all the records from Ginger from all the different hospitals will come up there. Or maybe you want to narrow that down and say, you know what, I don't really care what happened last year, just show me what happened in the last 30 days or 3 months or 6 months, and you can filter by that way as well. Okay, so now we are going to go on to medication. So I kind of look at like the results, information, and the medications. That's kind of the meat and potatoes of VITLAccess for me. When I click on medications, I'm going to see a couple of things at the top. I'm going to see allergies and medication alerts. I'm going to get back to that in just a second because as, again, my hat now as a care coordinator is that I'm really interested in what happened with her medications at discharge. So if you remember, she was on Claritin, so here's her Claritin. She was on metoprolol. Now her discharge report said that she was on 25 milligrams of metoprolol, and here we see a 50 milligrams. Maybe she's cutting those in half, or maybe this is an old prescription, and we can see that in this particular case, this hasn't been refilled since April 4th of last year, so maybe this is an old prescription. This is where, again, the clinical data that I talked about earlier, it's not quite matching up. We'll kind of pretend that this is actually a recent refill. But this is going to bring something that we're going to want to talk to her about when she comes in. We also have her warfarin or Coumadin. Looks like they substituted the brand name. She also has her metformin. And there's a couple of other medications on here, like her Lipitor. Now, what you're seeing here is these are the medications that were actually filled versus the medications that we saw on the transcribed report. That's the reconciliation that they did at discharge. So those might be what were ordered. We're going to use those in combination to do a medication reconciliation. So we'll look at what was ordered versus what was actually filled. And here's where we're getting fill information. So we're going to use this information to actually do the reconciliation with the patient when she's here. Now, the other thing that I noticed is that she was prescribed oxycodone, but I don't see that on her med list here. Those controlled substances are going to show up in red, so we'll see those really clearly that, oh, she hasn't filled that, so maybe she hasn't needed it, or maybe she was confused about how she's supposed to be taking it. So again, something that we'll need to clarify with her. Anywhere within VITLAccess, when there's a plus sign, you can see when I did that with, I think I did that with the metoprolol. When I click it, it expands it, and it'll give us a little bit more information about it. So here she's prescribed a 90-day supply, and she was given 130 tabs. So does that make sense for how she's supposed to be taking it? Okay. The other thing I wanted to point out here is the medication query. So if this is the first time that anybody's ever accessed Ginger Snaps' record, and this is going to be all blank until we run a med query. The medication query is done in real time, and it's done nationally. So this is the only page where we're getting information outside of the walls of Vermont institutions. So if this was and we can see that the last time this was run was on the 13th. I would likely want to go ahead and run this if she was going to be coming in, because it's however many days past that now. But if this was just run yesterday, I might not find the value and go ahead in running the query. And it does take a couple minutes for that to run. So it gives you the decision about, do I want to spend the few minutes of running the query? If it was just run yesterday, I really don't think much is going to have changed since then. And you can actually only run it once every 24 hours as well. So if this was just run yesterday, if it's been within the 24 hours, it actually won't go to do the query anyway. I think that's all. And this is a 12-month history of medications. The next thing so I'm going to go back up to our alerts here. So here we're getting allergies, and these are going to be coming from, again, the 3 different organizations that are sending histories. So somebody has reported out of Alderbrook, UVMMC, and RRMC. One of those institutions or organizations has reported that she had a penicillin allergy as well as seasonal allergies. The medication alerts, this gives us some clinical decision support, and there's a couple of different types of alerts that we might see here. This first one is the non-compliance. I'm going to highlight the non-compliance of her test strip. So she's diabetic, and if what this tells me is that she has had refills for these test strips, and she hasn't been filling them. So this is going to highlight that, and we're going to check with her on how frequently she's really testing her sugar, because if she's supposed to be testing those 4 times a day, but she has not refilled her test strips in 6 months, then we might want to confirm with her that she is actually testing like she should. The interactions, you're going to see an alert for both drug-drug interactions as well as drug allergy interactions. So if she was prescribed a penicillin, that would show up. And in this case, she's prescribed both warfarin and a sulfa drug, which is a really dangerous combination. So we're going to bring that to the attention of the clinician that's looking at this. Another thing that we might see is a duplication, and the duplication means that there are 2 of the same class of drugs being prescribed, and that might be completely appropriate therapy. But again, it just brings that to the attention of, hey, by the way, did you know that you've got 2 benzos ordered, and maybe that's not what you want for that patient. I think that I've covered everything that I want to on that. Next, I'm going to go to the Documents tab. And now before I go in to an actual record, I'm going to talk to you a little bit about CCDs. So CCDs, or what's known as continuity of care documents, they were born out of meaningful use. And the intention is to aggregate basic medical and administrative information that can be forwarded to another provider in the support of care transitions. They kind of build on themselves like Legos. So when you go to a doctor's visit, and you're at it, like in the case of Ginger here, so she has chronic diagnoses of AFib and osteoporosis and diabetes. Now she has a diagnosis of a fractured wrist and a concussion. Those are going to be added to her CCD. So anytime she has a visit, that information will be added to the existing document. Again, because I am as the case manager at Alderbrook Family Health, I'm not going to probably find a lot of value in going into my own document unless my EHR is down, and let's say we've got planned downtime, or the power went out or something, and I need to access her records. But normally I wouldn't necessarily go into my own record in VITLAccess. So I'm going to go down to University of Vermont Medical Center has a CCD on her. And I'm going to click on this. Oh. And again, I want to point out at the top of every page, you've got where this information is coming from. So this information, in case I forgot which one I clicked on, it's going to tell me this is from UVMMC. Now, again, going back to the meaningful use piece of this, is that any EHR that is what we call certified as a meaningful use EHR, they all have the capability of generating a CCD with the same information. That doesn't necessarily mean that all that information is there. It depends on what the sending facility fills out. But this table of contents where it says allergies and medications, problems, those are all required to be available in the CCD, if that makes sense. If that doesn't make sense, we can clarify that in the question and answer session. And what I'm going to highlight here on this CCD is information that you can't find in other places in VITLAccess. So we've seen her allergies, we've seen some medications, we've seen problems. But actually with our medications on a CCD, this is a little different than the medication query because these are medications that have been prescribed, and these are the medications that UVMMC believes she is taking. So the medication query is fill information, medications that have been filled. These are the ones that have been ordered or prescribed. And in some cases, like here we have aspirin. This is an older medication and it shows that it was discontinued. So this has a little bit more history and it's going to go beyond the 12 months of the medication query. So when we're doing med management and medication reconciliation, we've got a lot of pieces that we can put together, including verifying these with the patient in order to reconcile her medication. So I'm going to scroll down a little bit. We've seen results. We've seen, actually, in the results section, we have the bone scan results. I didn't call that particular one out, but we can see that within VITLAccess. Advanced directives is one of the required fields. Again, that doesn't necessarily mean that every organization is filling it out, but they have to be able to. So for Ginger, she's a do not resuscitate. I'm going to check and make sure that that matches with what I have at Alderbrook. We have a family history here, so we've got some information about her father. We also have immunizations. There's not another place in VITLAccess that we can see this. So according to UVMMC, this is her vaccination history. And again, you kind of look at these. We've got a date of 1999, 98, 98 for pneumo. So anytime she has immunizations added, again, this is where we get to the Lego piece, is that these will keep getting added to her immunizations at every visit to UVMMC. This, I think, is great. We've got a plan of care. She's due for a colonoscopy, and we apparently looks like that's either scheduled or that's been called out that she's supposed to have that in 2018. We also have a social history of smoking and her alcohol use. And clinical information that we don't see necessarily in other places, and that's her vital signs. Now, this document can be quite long depending on the history. If she has many visits at UVMMC, we might see pages of vital signs, which is great because we can see a trend. What you want to do is, and I'm going to scroll back up to the top here, all of this information, no matter what organization it's coming from, will be listed in the same order. So even though this document is really long, you know exactly where it's going to be. So if you're looking for vital signs, they're going to be at the end. And they're going to be at the end whether it's coming from UVMMC or Rutland. Okay, so we've got a pretty good picture of what's going on with Ginger. Now, prior to Ginger's visit, I'm already focused on questions regarding her medications. I've got quite a few questions for her, actually, about her medications. Perhaps I'm going to contact the VNA to get an update because according to her discharge summary, she's been on VNA services, make sure that those sutures have been taken out. And I already have a basic understanding of her admission and hospital course, so I don't need to go running around tracking down information from Rutland. That I already have a lot of that information within VITLAccess. Another scenario might have been if I received a patient ping, like Fran talked about earlier, about her admission. I could follow her hospital stay. If she's been opted in already, I can, because the information that's being sent to the VHI is in real time, if I'm highly concerned about this patient, I can watch her labs as they're happening because, again, they're posted in real time. So that concludes my demo. I'm going to pause for just a second and get back into our slide deck. Okay, take it away, Fran.
Thanks, Kat. VITLAccess can provide high value for the following types of patients: new patients, transferred patients, patients treated at multiple locations, high-risk patients with multiple comorbidities, high utilizers of healthcare, for example, high volume of ED visits or history of doctor shopping, and poor historians. We have presented this slide in the previous webinar, but I'd like to reiterate its significance. This graph represents patients' movement within the healthcare system. While this may look different depending on your geographic location, It is not uncommon to see a patient that seeks care outside your organization. The pie chart on the right is an example of patient data in the VHI for patients who have received treatment at Northwestern Medical Center. When looking at the graph, we see that only 25% of that patient information originated at the local hospital. 47% of the data came from Vermont's largest academic medical center. A clinician at MMC likely has access to UVMMC's EPIC record. However, 28% of their patient data live outside NMC and UVMMC systems. EHRs and VITLAccess are very different in their functions. EHRs contain the small details of a patient's medical history and are generally limited to the data that are created at one's organization. They are an instrument to create, manage, and report on a patient. However, EHRs may not contain all the information to provide timely, safe, and high-quality care. Health information exchange, such as the VHI, provide clinicians with information outside the walls of their EHR and their organization at the point of care. While the data contained in VITLAccess may not be considered as deep as your EHR, it is more expansive. Like pieces of a puzzle, information from both your EHR and VITLAccess fit together to give you a more complete patient picture.
Thank you, Kat and Fran. If you're a current user of VITLAccess or other services provided by VITL, this slide provides information on how to contact our client technical support team. VITL uses a ticketing system and you can submit issues by visiting www.myvital.net. Also, if your patients have questions about providing consent to share their healthcare information, you can direct them to our patient consent line at 1-888-980-1243 during normal business hours. And if you need or want more information about VITLAccess, please contact us at clientservices@vital.net.